I think a lot of things to be mindful of when dealing with Aboriginal people is there's a lot of historical content that is stigma, fears, so it has to be done in a very sensitive way. I think that everyone is individual. We all are human and we all have feelings, but as an Aboriginal person there's a lot of fears in regards to they are descendants of stolen generations, and there's a lot of fear around children getting taken away from their families. So there's going to be a lot of guardedness and around protecting what's theirs and what their family is. What we have identified is having a clear, honest conversation with them, especially when it comes to using our tools and our paperwork. So we try to be honest from the start and very clear in what we need to do as professionals. A lot of the times we recommend that if there's an Aboriginal person available, then utilise your Aboriginal staff to build up that trust and rapport with the client. Also, if there is no Aboriginal person around, we try to upskill our colleagues in how to get the message across in a clear and simple way that our Aboriginal people can understand it. So the first thing that you would do is you let them know what the forms are about, and you give them a bit of time to process that. So there's nothing wrong with a bit of a silence while you're waiting for a response from the clients. If you give them that little bit of time to think about what they're going to be answering, it allows them the opportunity to let down their guard and gather their thoughts and the information. As I said earlier, there are great fears around if there's family violence that their children are going to be taken away. So I think if you make them feel really safe and letting them know that, be consistent in the questioning so that it doesn't have to be, moulded to different people, giving them that time to actually hear the question and then repeating to them if you'd like me to talk it down for you into plain language, then that would be easier for them to understand. I think a lot of the big words scare a lot of our people and they are quick to answer yes and no and they really don't understand the question. So really having that, giving that time to let them recognise if they understand the questions and can answer them properly. What we can do to make it better is, just make them feel very safe. I'll always go back to making them feel very safe and letting them know that, no one wants to take away their baby. Our services are here to help them. It's a international problem, it's a national problem, it's just not targeted at Aboriginal people. Also allowing them to hear the words that this is something that we use for everyone is one of the greatest things, and you as the interviewer are the tool as well. So how you deliver the questions is going to make a big difference in the answers. Most of the times they will be able to communicate either by body language or verbally. I think that sometimes in our role, a person might be saying something that no, it's not happening in that there, but their eyes or their body language or there's some indicator that we can, sense. But it's never okay to assume that something's going on. It might just be other things that are rolled into one. There's lots of things that affect Aboriginal families. They might think that nobody cares about how they're feeling. So it really is around giving them time to answer those questions. They realise that they're in a caring environment, so they already feel safe because they have to be cared for by the people that are around them. Consistency again, maybe keeping up with the same worker while they're in care instead of chopping and changing. Sometimes they might not answer the questions there on the time, but if they've got that consistent worker and they are able to build up that trust with them, they can, answer the questions in their own time. Getting them to explore their options is the main key. They might think that they have no options, so just gently allowing them to explore them by listening. Visual as well, if you're with them. Aboriginal people respond to visual things as well, so if you've got the pamphlets and stuff, go through it with them and actually talk them through it. Once again, taking your time to really let them absorb that information instead of it all being thrown at them. One of the things we do get results from is the yarning part of things, so not really jumping straight into all the clinical stuff. So making them feel comfortable, and I think it's just a courtesy thing as well, and introductions are always the first things. You identify your role and what you hope to get out of your interview as well, and just really going back to them, making them feel really safe. No one likes to be questioned straight away, so keep the questioning very, very simple, and always reminding them this is a process that we have to do with everyone and it's not just you. And I think that's where they get that safety element from. So I think that all the interactions that you have with Aboriginal people, is the first thing is to be very respectful and be mindful of the trust, and letting them know that you are there to help them, and also you're there to promote good health for them and for their babies, and letting them know that no violence is acceptable, and it's not a colour thing, it's not a culture thing, it's not a religious thing. No person should be subjected to family violence.